So a little background. So in Europe, the venous and lymphatic medicine, they're phlebology, and that's really a branch of phlebology. Whereas in the United States, phlebology, venous and lymphatic medicine are really a more of a multi-specialty group. But back in the 1980s, Jeff Klein developed a Tumescent liposuction technique. And people came from around the world, including Dr. Sattler, to learn this technique from Dr. Klein. And then Dr. Sattler brought that back to his dermatology colleagues in the Rhineland, southwestern Germany, and Dr. Rapprich and others started doing this Tumescent liposuction. So again, because these dermatologists were also, venous and lymphatic specialists, they would see lipedema, and they not only would see, but they would recognize lipedema in their patients, and they would treat them with compression, as was the only thing to offer at that time. But Dr. Rapprich had a particular patient who was in a great deal of discomfort and had not gotten any relief from her compression, and so she prevailed upon him to do liposuction, and she had a great result. So that encouraged him to do more, and then soon other colleagues in his dermatology department and around the area began doing more. And then that led to the first publication presented at the Paris Dermatology Conference, and then more dermatologists and lymphologists. And believe it or not, these guys are all practicing in a relatively close proximity, and they were really the first to publish papers showing effectiveness of this surgery for women with lipedema. But then there's a backlash, and so the lymphologists in the head, one of the thought leaders, writes the textbooks. His name's Michael Foldy. He has clinical experience of patients who have lymphedema after liposuction. So this is part of a chapter of his book. It's available on the internet, but says this treating lipedema with surgery, suction, lipectomy is can cause lymphedema. And he goes on, lymphedema is a much more serious disease than lipedema. People don't die of lipedema, but lipectomy is not a minor procedure and can even result in death. So there's backlash. Now it's also for quite some time, there's experimentally, we know that we interrupt these lymphatic channels and we create lymphedema. This is a picture of a mouse tail. This is one of the most commonly used, research studies ways to create lymphedema, and you can see that. You can see that there's a. Okay, yeah. So you can see as you go from left to right the increase in width. Okay. So this led to heated reactions in medical meetings. I mean, they were saying, "You are killers of lymphatics. This is dangerous." These are the other colleagues to these dermatologists, and so they coined back to the research. They came up with this idea of validating through anatomic studies that they could safely do this lipectomies on these patients and not create lymphedema. And there was dye studies and very and then there was And then the plastic surgeons joined, were convinced, and Dr. Hakan Borson, and then about 6 to 8 years later, the U.S. plastic surgeons joined, the dermatologists and lymphologists, and then there was a whole array of studies showing gradually increasing benefits, increasing size of the studies, decreased need for compression, decreased swelling, increased quality of life, and these were over the next 10 to 12 years. And then there's the long-term follow-up by Baumeister, another in phlebology, another dermatology, and then 8 to 12 years. But lymphatic injury still can occur, and we don't know how common, but it is possible, and happens. And then we just recently, have further that there's mobility, knee mechanics, and this is all in that tradition that's called lymph sparing liposuction, but is that's not the greatest name, because there is lymphatic disruption So finally, careful technique is important for treating lipedema surgically. Longitudinal cannula strokes is been validated by lymphologists, and that's what was called, poorly named, lymph sparing. The evidence for the effectiveness of this has been growing exponentially for the years, and new studies, newer specialties have joined, and finally, these have this more varied techniques needs to be studied more. Thank you.
All right, actually, quick question for you, maybe 20 seconds. Do the lymphatics heal? I mean, they're damaged like blood vessels. Blood vessels don't continue to bleed. Can lymphatics heal?
Yes, they do. Anytime you do any surgery, any trauma, lymphatics are disrupted, and they normally grow back. There's a whole healing process stimulated by VEGFR, but it does. It's only there seems to be these principal collecting ducts on the fascia that are less tolerant and less likely to recover.
Great. Thanks, Dr. Wright.